You ready?
Go for it.
Dr. Lynn, I'm a 70-year-old male patient who's had the symptoms for probably 15 or 20 years of being very difficult to urinate. And when I did urinate, the stream was so weak that it basically sprinkled. I found out about UroLift maybe 4 or 5 months ago. I looked at the video. I looked for a urologist, and it just turns out my son had used you for another procedure and recommended you, so I came in. We investigated the UroLift. You gave me in explicit detail exactly what symptoms that would cure. Today is my 6-week post-operative interview. I am very pleased. Although I don't have a stream like I did when I was 20 years old, at least I have a stream now when I urinate.
Great.
I can go several hours. I can take a lot of fluid intake. When I actually feel the need, I can actually start and complete. Those are all positives that were not present on December the 7th. I can go usually once or twice during the night, depending on my intake of fluids. That's a great advantage. And the best part was, even before this procedure, I felt like even after I would urinate, the minute I stopped and thought that I was complete, within 2 or 3 minutes, I felt like I hadn't gone, and I had that constant feeling and urge to urinate and just couldn't do it. Now, if I have the slightest urge, I can do just like your mother said when you left the house, go before you leave, and I can do that.
That's
great. And I can almost do it on command. So I am very pleased with this procedure, and I would recommend it. Now, the post-op, since it was done locally here and in-house, the recovery time for me, you said I'd have maybe some bleeding for as long as a week or so. I had the procedure at 1400 hours on a Friday. By midnight, I had finished bleeding. I didn't have any more bleeding after that. And by day 3 or 4, I was pretty much back to normal in the urination department.
That's
so
great.
Again, it's all good. It's all positive, and I can highly recommend it.
Wonderful. Was there any problems with controlling your urine, leaking urine, urinary incontinence?
No.
Okay.
No, I've had no incontinence.
What-
I don't leak.
What about any changes to your sexual function?
No, actually, it's kind of enhanced.
Okay. It's interesting. UroLift is not designed to enhance sexual performance, but I have had many patients tell me that it has improved their sexual function after the UroLift procedure. So that's very interesting to hear.
Actually, that was one of the, I probably should have mentioned that. That was one of the side benefits, is that's actually improved the orgasm, where it used to be kind of a shot, and prior to this procedure, it was kind of a slow, here it comes, no pun intended, but
Yeah.
but now it's kind of back to that, and so that's really pleasing.
Wonderful. That's so good to hear. I'm so glad that you had such a nice outcome and fast recovery. May I share this video with those who may be interested in this procedure?
Absolutely.
Thank you so much.